Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about alternative methods to help explain and treat medical conditions and to help you achieve and maintain health. In our last show, I talked and hopefully educated you on the importance of vitamin D and the vital role that it plays within our bodies. To refresh your memory, vitamin D is needed for calcium absorption to make bones strong. It's needed for energy production, for strong muscles, for insulin production, and it's vital for your heart and so much more. Literally, I receive 1 or 2 notifications every week regarding new studies on vitamin D and the tremendous benefit it provides in every facet of your health. For example, a few days after the taping of our last show, I received news study from February 8th in the issue of Neurology, the autoimmune study. It was published and states that sun exposure and subsequent production of vitamin D are associated with a reduction of risks of people getting multiple sclerosis or MS. As I stated in our last show, for thousands of centuries, we humans have been out in the sun in the environment working and living. The sun is our friend, and vitamin D we derive from the sun is one of the nutrients that is absolutely vital and allows us to have better health. Speaking of better health, let's define what I believe health really is. And health is not merely the absence of disease, but rather a homeostatic balance of the systems and processes of our body. It is the harmony of the 12 systems of our body that allows our body to function in a healthy manner and hopefully prevent disease. Again, this show has been designed to provide you the information that you can use to be better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to help inform you about these treatments and therapies as we all strive and seek better health.
Ready to go?
Yeah, but the fire's not out.
It's close enough.
Close enough? If it's too hot to touch, it's too hot to leave. I mean, the next thing you know, you've torched our whole neighborhood.
Which is why we're not going anywhere?
Exactly. 9 out of 10 wildfires are caused by humans.
Only you can prevent wildfires.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
Welcome back. Today in the news, it was reported in the Wall Street Journal on February 24th of this year that children living on farms have a lower risk of asthma than children who don't, because the children in the rural areas are surrounded by a greater variety of germs, according to 2 large-scale studies. This study, published in the New England Journal of Medicine, stated that asthma in children has doubled over the last 30 years. The theory lays the blame on the parents trying to keep their children too clean and not allowing their children to be exposed to a large variety of germs, thus allowing the child's own immune system to properly develop. Although additional research is needed, from my point of view, this makes complete sense. It follows that when we're exposed to bacteria and viruses in small quantities, that our bodies can generate a protective response that won't hurt us, and in the long run actually keeps us more healthy. This is exactly how vaccines work. So it only makes sense that a greater exposure to a greater number of germs would work in our favor. Our next story comes to us from the University of Miami Miller School of Medicine in Florida. And I have to tell you that this story really hit home for me. This study reports that people who drink diet sodas every day experience a 61% higher risk of vascular events than those who report drinking no sodas at all. First, I have to admit that I used to be a heavy soda drinker. But the point I want to make and bring to your attention is that people who drink these diet sodas, because they are not making healthy choices when they drink them, in fact, they're contributing to the risk of stroke, myocardial infarction, and vascular death. The take-home message here, one that I learned several years ago, was that those people who drink these sodas, they have ingredients that can cause harm to the body and should be avoided at all costs. Another important study caught my eye a few weeks ago about nutrition and cancer. From the University of Alabama at Birmingham, it was reported that a number of cancer survivors in the United States in 1971 was estimated to be about 3 million people. But today, that number comprises about 4% of the U.S. population, or about 12 million Americans. Now, this number is wonderful news because it demonstrates the remarkable progress that has been made in saving lives for those who have been diagnosed with cancer. However, there is a flip side to the story, and that is the issue of quality of life of those cancer survivors. Most notably, cancer survivors face a number of other health-related issues, including cardiovascular disease, diabetes, osteoporosis, in addition to the possibility that they have their cancer reoccur. And it happens and it appears that these chronic health concerns can be prevented or managed by nutrition. Again, if you've seen any of our previous shows, you know how important it is, and I believe nutrition is, to our overall health and well-being. This is just another example from another study that demonstrates that what you eat, or more importantly, what you don't eat, can have a tremendous effect on your overall health. We're going to take another short break, but when we return, we're going to take a short course in anatomy and look at one of the major reasons for visits in the emergency room, and hopefully I can demonstrate to you how to avoid those ER visits. So stay tuned.
Did you buy the flashlight and the batteries?
Yes?
Did you make sure we're not missing anything in the first aid kit?
Yup.
Did you go through the plan with the kids again?
Yes.
The more you prepare today, the more you'll be able to reduce the devastating effects of a tornado, an earthquake, a power outage, or any other disaster. Get a kit, make a plan, be informed. Visit ready.gov.
There's a lot of talk out on the street about his mother, your mother, their mother. But in the end, is anyone really even thinking about them?
Welcome back to Better Health. I'm Dr. Stowe. As any regular viewer of this show knows, my clinical practice and the way I treat my patients is based completely on scientific research and proven treatments for a variety of conditions. I know of no other way to treat my patients or their conditions. These proven treatments that I speak of have both scientific research that supports their use, in addition to empirical evidence that I and others have accumulated over the years as safe and viable methods to assist in the reduction of pain and the elimination and the cause of that pain. It is the elimination of the cause of pain that is a major difference between CAM and allopathic providers. So imagine how amazed I was to read recently that in 2008, there were roughly 3.4 million visits to the emergency room for back pain. That is approximately 8,400 visits a day. Further, there were more than 663,000 inpatient stays in hospitals for a daily average of 1,820 patients in hospitals for back pain. Now that number is amazing to me, and it reports in those in-hospital stays, it costs $9.5 billion. Let me say that again, $9.5 billion for patients who stayed in the hospital for back pain. That doesn't include the costs associated with those who were seen and then released. That to me is an amazing and incredibly high cost to our society for such a common disorder that I and many other holistic doctors treat and treat very successfully each and every day. Now, for anyone out there in TV land watching, I don't want to give you the impression that someone with pain shouldn't go to the ER of their local hospital. That is what they're there for. However, if you dig a little deeper, you might be surprised to learn that many people seeking those ER visits have chronic back pain, and they've been dealing with that pain for years. I hope this doesn't come as a surprise to anyone. 3.4 million people don't just wake up with pain. Most have been dealing with the pain for years, and each time they're probably given the same advice and the same medication. Anti-inflammatory, a muscle relaxant, and some sort of painkiller. But do these treatments really work? Do they get to the cause of the back pain and really treat the issue? And the answer, of course, is no, they don't. If they did, we wouldn't see so many people in the ER again and again for the same back pain. Now, before I get into the treatment options that are available through complementary and alternative medicine, treatments that have been proven very successful, I want to first educate you on exactly what the anatomy of your back looks like. So I'm going to go to the computer and we're going to take a short anatomy course. We're going to look at, first you're seeing a skeleton here, and this is the front of the skeleton. And I'm going to turn it around so you can get a full view. Now we're looking at the back. This is how you would look coming from the back. What I'm going to do now is just build layers on top of the system that you're seeing. And I'm going to do this kind of slow at first so you can see what I'm looking at. You can see right up in this area, hopefully you can see that there's these ligaments and tendons that have been added to the spine. So that's the first start. Now we're adding some muscles, and as we add these muscles, I'm going to turn this around so you can see from the front. We're going to build this spine until we come all the way up to the surface. So here's some more muscles in the red. These little bitty red areas are connecting spine to spine. You can also see there's some down here that come through the pelvis. The back is a very delicate instrument, but it functions so well. So our next layer up, we've got a big muscle here called the iliacus, and it's a major cause of problems in the back, although it's very seldom looked at for cause. This one up here is called the psoas, and I'm going to show you a little bit more of the psoas because it's one of the ones that I treat most often for people with low back pain. Turning it around, we're looking at how, again, the back has been developed, and I want you to notice that these muscles go all the way up, sorry, went a little too far, all the way from the pelvis, all the way down here, and follow all the way up your spine and attach to your skull. So sometimes people will come in to me and they'll say, I've got a headache or my neck constantly hurts, and I may treat their low back or vice versa, and they're like, why? How can you treat my headache and treat my low back? Well, there's part of the reason. If these muscles down here have been injured or damaged in some way, it's got a direct connection to the neck and to the back, the skull rather. We're going to build on it a little more. Sorry for the slowness of the computer. Here you go, we've got muscles now between the ribs, and notice that there's an attachment between the rib muscles to the muscles here that attach directly to the spine. We'll go a little bit further. Now we've added some more muscles, again, directly to the skull, coming right down the spine, all the way down. Now these connect to the muscles that were there before. I'm going to go to the front and take a view that way. Notice how thick those muscles are of the neck. I want you to also notice that we're building on the spine, but look at the neck muscles up here that are connected. These muscles up here in the neck that go to the front and the back of the skull all swing around and connect to the spine. Here's a great big muscle right here. Oop, lost my mouse. There it is. Here and here also. Again, they connect to the lower part of the spine. So what you're looking at is a tremendous number of muscles, different connections, and they all go to the spine. A little bit bigger here. We're going to move up, if you will. My computer's giving me a little grief, but we'll work through that. Here's again, we're getting deeper. Notice this white area in here. This is called fascia, and the fascia is becoming a very large area of study for many doctors because of its attachment site to major structures of the body. Treating fascia is becoming one of the newest ways to help people who have been having back pain, whether it's low back, mid back, or in the cervical. Okay, also I wanted you to notice this is where we started on the left side. We're keeping this clean. It's the right side we're building up. So we're going to go a little bit deeper, actually coming up. We've added more muscles. Again, they attach to the spine and back up to the neck. These muscles now over here connect from the ribs, connect to the muscles that were underneath, and then come on down into the pelvis. These are cross muscles. These muscles go across for stability. When you look here, they connect to the spine and in the lower portion of the spine, and they come over here and connect to the ribs. I have many patients who say that, I have a hard time taking a deep breath. Well, if you look closely, here's the low back attachment, and here's where it comes over and hinders rib function. So, and you've got them up here also. So the body is so integrated and so tightly woven. When you come into someone like myself or an emergency room and you say, I've got low back pain, hopefully you're getting a sense of why it's so difficult to really treat. That's where someone who's very well versed in anatomy can really make a difference. All right, so going again, we've got some of the bigger muscles coming on top, and I want you to notice here again from the skull over now to the shoulder. Many times I have patients come in and they complain of shoulder pain, but the cause of the pain is maybe coming from these muscles attached to the skull or all the way down here in the middle back. Again, that's one group of muscles, and then here's this other superficial group that connects underneath that all the way down to the coccyx. Women are familiar with coccyx, especially if you've given birth, and they come from the spine and come all the way over here and attach to the arm. Okay, they're up underneath here. Look at all of these things connect together. And so people come in and say, well, I've got low back pain, and I start looking at their neck and they're going, are you nuts? No, I'm not nuts. I know anatomy. Let's go a little bit further up. We're going to look at now, this is the nerves as they come out. We're not going to really concentrate on the nerves too much. We're adding some vessels, dermatones, more dermatones. I want to get to one other section here. This is where the veins are, and I'll flip this around just so you can kind of see. So here's not the heart, but the major organs. We're going to go through just a couple of more. There's the veins, the other one was the arteries, nerves. Look at all of those nerves, and then finally shoving them together. We'll go back and look on the back side. Is it any wonder that someone who has back pain and can't get it solved, why and how it can be so complicated? And that's why dealing with someone who is a specialist in understanding the body and these different layers from all the way from the skeletal all the way up, to understand exactly what you're needing to treat, because it can be anywhere. Your problem can be anywhere. Okay, so now we've had a little anatomy behind us, and I hope you can understand and appreciate how difficult it might be to treat such a complicated yet wonderfully functional structure. But what exactly do I and other CAM doctors do every day? We treat this sort of condition. We're first going to look at a complete history. When I'm looking at a patient who comes in, we're going to take a complete history and a physical examination. Both of these are valuable tools in helping us to discover which of the many structures in the back are causing your pain. Sometimes advanced diagnostic testing is ordered for more complicated cases, but once the cause of the pain has been determined, it truly is generally a relatively simple process to derive a treatment plan, follow through on that plan, and then assist the patient with a long-term plan to hopefully eliminate future reoccurrences of their pain and their dysfunction. But certainly someone out there has to be saying, if it is that easy, then why are so many people in the ER or simply living with back pain? And the answer is, I really don't know. In my many years of practice, I have only had a few patients with back pain that I wasn't able to treat successfully. I have to assume that part of the problem is with most Americans, they've decided that they need or want instant results, which is what prescription pills can provide. But I have to tell you, while CAM treatments work very, very well, generally they do take some time. They're not immediate, although they are long-lasting. Another reason could be that for the long-term relief of back pain to occur, the patient has to be actively engaged in their own health. I don't simply mean they do a few stretches for a week or so. What I'm talking about is a total engagement and sometimes a lifestyle change in lifelong habits. Another issue that is vital to patients with back pain is to understand what you're doing is damaging cellular tissue, which can take up to a year to completely heal. Now, with that said, while prescription pills can take away the pain, that doesn't mean they've taken away the cause of the pain. So what happens many times is that the pain subsides, you've taken the prescription, the pain subsides, the patient starts to feel better, they start doing things they maybe shouldn't be doing, but because they aren't feeling the pain, they think they're okay. In reality, they're really causing more harm to that already damaged tissue, and before you know it, the damage is greater than before, and now the pain is greater. It is just this huge, giant downward spiral. What has to occur for the patient with back pain to feel better is to stop this vicious downward spiral. The patient has to receive proper treatment for damaged tissue and or the structures that are causing the pain, and typically this really isn't accomplished with drugs. Then changes are required to stop the continuing damage of the underlying structures and then strengthening those structures to provide long-term relief and benefits. Okay, so what treatments do I and other CAM providers use, and how is it different from what they receive from medical doctors? Well, first, CAM doctors don't use any prescription drugs. However, I and other doctors do use herbs and supplements that are very effective, and most have few, if any, side effects. Magnesium is one such example. Magnesium is an element in the body that is vital to many functions and is required in over 300 reactions within the body. One of those important functions is to relax muscles. I have given many patients magnesium and seen a significant reduction in their tight muscles, all from a nutrient that their body needs and has to have for proper function. Other types of treatments that are utilized for acute conditions with pain are E-stim, cold laser, a variety of muscle relaxation techniques, manipulation, heat, ice, acupuncture, and kinesiotaping. Then, once the patient has regained complete range of motion of the affected area without pain, then the rehab process starts, and that incorporates strengthening those weak muscles so that they can support the back and allow a normal activity of daily living to occur. Once this occurs, other techniques can often be utilized if the patient wants to then become more active and maybe start playing sports or some other more rigorous activity. Depending on how long the patient has been suffering with their back pain and what the cause of their dysfunction turned out to be, I've seen cases take from a few weeks to several months before the patient can come to complete resolution. But once the patient determines that they are tired of having this reoccurring dysfunction and they start taking responsibility for their own health, it typically isn't long before the pain is resolved and the patient is not only feeling better, but has a much better attitude toward their life and a brighter outlook on their overall health. There's one more segment to our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask me questions. So let's take one last break, and we'll be right back.
Any questions?
What kind of service plan does this come with?
Unlimited.
Can I keep my same phone number?
Absolutely.
How do I change the ringtone?
Just hook it up to your computer.
Does it have a camera? What's the warranty? Does it come in silver? Can I put my party shuffle on this? Does it have a 3.5 millimeter headset jack? You sell a lot of these?
It's the one I carry.
You ever get those phantom vibrations in your pocket?
Any questions?
No.
Are you sure?
Yeah.
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
This is so cool, Dad. Awesome. This is so cool, Dad.
You don't have to be perfect to be a perfect parent. There are thousands of siblings in foster care who'll take you just as you are.
I received a very interesting and flattering question from someone who says that they've been a viewer of every episode of Better Health. But before I get to the question, I want to say thank you to all of you folks out there who watch and support this program and HCC TV. I very much appreciate the opportunity to share with you alternative methods that you can use in order to achieve and maintain your health. But now to the question. This viewer asked how she could become a CAM provider. Well, that's a rather vague question because it really depends on what type of complementary and alternative provider and what type of service you would like to provide. To become a doctor of chiropractic like I am, or a naturopath, or a doctor of osteopathy, you'd first have to have an undergraduate degree with emphasis in biology or chemistry or something like that, and then complete a 3 or 4 year doctorate program. To be an acupuncturist, that can take 3 to 4 years. And there are other programs like nutrition and wellness that can take months to years. The best advice I could give someone is to think about what fields or areas that you are currently having interest in, and then do some research to determine if there are doctorate or graduate programs that would allow you the pleasure of helping and treating others. Well, this ends this episode of Better Health. I hope you've enjoyed the show. It is my desire to help educate individuals about a variety of condition and treatment options that exist outside of conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only. Any condition that you have or think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me your questions that you might have regarding today's show or any other topic related to health. Just send me an email to hcctv, and as time permits, I'll answer your questions on air. Until our next show, take care, enjoy life, and live healthy.